Hello, I'm Tony DeMaria, the editor of JACC, here to tell you about some of the highlights in the forthcoming April 3rd issue of JACC. And we have two papers in that issue that deal with the question of what is the optimal technique to size the aortic valve annulus in patients undergoing transcatheter aortic valve implantation, or TAVI or TAVR, whatever terminology is used. And traditionally this has been done by transesophageal echocardiography. But we know that there's been a 15 to 20% incidence of aortic regurgitation with significant adverse consequences. And so the question was, could computed tomography yield a superior measurement of aortic annulus size to guide the selection of the prosthetic valve size? And in a study done in the United States at Cedars-Sinai Medical Center, and in another study done by investigators from Canada and Germany, the results were similar. That is to say, computed tomography yielded a superior quantitative assessment of aortic annulus size, so that there was less aortic regurgitation that occurred following TAVI. And in fact, the group from Canada and Germany suggested that there was some evidence that oversizing the prosthetic valve might be of value in reducing aortic regurgitation. So I think given these two studies, that there's pretty good evidence that computed tomography is probably the preferable way to go in patients who are being evaluated for TAVI. A second study deals again with the transcatheter valve procedure, here the mitral clip for mitral regurgitation. And the question was, in the Everest II trial where the mitral clip was evaluated, did patients with atrial fibrillation have comparable results to those without atrial fibrillation? And the bottom line answer was yes. Whether they looked at the reduction in mitral valve severity, mitral regurgitation severity, or whether they looked at the comparability with surgery, patients with atrial fibrillation were essentially identical in outcomes. So they remain good candidates for mitral clip procedures. Finally, there was an interesting study dealing with the role of metabolic syndrome in patients undergoing ablation therapy for atrial fibrillation, and whether that predisposed to recurrences of atrial fib. And in fact, in this study done by a multi-center group, what they observed was that patients with metabolic syndrome did in fact have a higher recurrence rate after ablation therapy. Nearly all of it, or most significantly, in patients with non-paroxysmal atrial fibrillation. And those patients, not surprisingly, had higher inflammatory markers. So another reason not to have metabolic syndrome, that is to avoid having an increased rate of recurrence if you have to undergo ablation for atrial fibrillation. For Inside JACC, I'm Tony DeMaria.